Podcast 37, Week 39. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 39. You're pretty big by now, and you might not be able to do some self-grooming chores. You might have to ask your partner to cut your toenails or shave your legs. If you approach it with humor, it may be something you can both laugh about in the years to come. You may have been told by friends not to raise your arms over your head or to reach high because it may cause the cord to wrap around baby's neck. Relax and don't worry. Nothing you do during pregnancy causes or prevents this from happening. Feeding your baby is one of the most important things you'll do as a mother. The nutrition you provide will affect baby for the rest of his or her life. If you have questions, discuss them with your doctor and baby's doctor. Will you breastfeed or bottle feed? The choice is yours. You may decide to breastfeed baby. It may be the best nutrition you can provide. Breast milk provides many benefits for baby that can't be duplicated by formula feeding. Breastfeeding supplies important nutrients, antibodies to help prevent infections, and other important substances for growth and development. If you have problems breastfeeding, people are available to help you at the hospital, such as nurses and breastfeeding specialists. Your local La Leche League can also put you in contact with a breastfeeding counselor, or you may meet with a lactation consultant. Some women choose not to breastfeed. You won't be considered a bad mother if you bottle feed. A woman may try to breastfeed, but it doesn't work out. Some babies have problems breastfeeding or can't breastfeed due to a physical problem. Lactose intolerance can also cause problems. If you bottle feed, you can still provide good nutrition for your baby, and baby can get the love, attention, and nutrition he or she needs with bottle feeding. Your uterus is a muscle. It contracts like muscles do, so baby can be born. I'm going to be honest here. Labor can be painful. Pain can be caused by uterine contractions, pressure on the cervix, pressure of baby on the bladder and bowels, and from stretching the birth canal and vagina. It may be impossible to determine which pain relief method will be best for you if that's what you choose. If you don't want pain medication, that's your decision. But it's helpful to know what's available in case you do need it. You might want to see how your labor goes before making a final decision about using pain relief meds. Pain relief options include analgesia and anesthesia. Analgesia medication decreases pain and discomfort. It doesn't completely block pain, but it does lessen it. Anesthesia medication provides complete pain relief. It completely blocks all pain sensation and muscle movement. When given to affect only a particular area of the body, it's called a block, such as an epidural block. It's similar to what the dentist uses to block pain when you have a tooth filled. You may have heard about an epidural block and wonder what it is. An epidural blocks pain between the uterus and cervix and your brain. It's one of the most popular pain relief methods used today. It provides relief from the pain of uterine contractions and pain at delivery. You can receive more anesthetic as you need it. Many experts agree a woman can have an epidural anytime after she begins active labor. You may not be required to be dilated to a specific point before getting one. Some medical conditions may keep you from having an epidural, such as a serious infection when you begin labor, scoliosis, previous back surgery, or some blood clotting problems. If you have any of these problems, discuss it at a prenatal visit. You may have problems pushing if you have an epidural, but you should be able to feel enough pressure to push. An epidural may increase the chances of an assisted delivery. A spinal block is often used with a cesarean delivery. Spinals work fast, within seconds, and can last from 1 to 2 hours, long enough for the cesarean delivery and repair to be done. With a spinal, you receive only one injection of local anesthetic medication. A third analgesia is a combined spinal epidural. The spinal numbs you quickly, but you can receive more anesthetic if you need it. The combination provides quick relief with the option of an epidural if your labor is longer. Occasionally, it's necessary to use general anesthesia for delivery, usually for an emergency cesarean delivery. General anesthesia affects the entire body and usually causes you to lose consciousness. A pediatrician attends the birth because baby may be asleep after delivery. There is no perfect method for pain relief during labor and delivery. Discuss all possibilities with your doctor and mention any concerns you may have. Ask about the types of anesthesia available and the risks and benefits of each. We'll discuss non-medical pain relief methods in podcast 38. You may have heard about storing blood from your baby's umbilical cord after birth. It's called blood cord banking. Umbilical cord blood contains stem cells which have proved useful in treating some diseases. If you or your partner have a family history of some specific diseases, consider saving and banking your child's umbilical cord blood. Blood can be used by siblings or parents, and in some cases by the baby who donated it. If you decide to collect and store blood for your family's use, the Cord Blood Storage Bank sends you a collection kit. Blood is collected directly from the umbilical cord after birth, before you deliver the placenta. There is no risk or pain to you or baby. After cord blood is collected, it's taken to a facility where it is frozen and stored. In many hospitals, expecting mothers learn about cord blood donation when they're admitted to the hospital. If you don't think you or your family members will need cord blood, you can donate it. Public cord blood banks provide those who need it with cord blood. If cord blood isn't used for patients, it may be used for research. When you donate your child's cord blood to a public bank, his or her name is added to the National Registry. If the child ever needs cord blood, he or she is guaranteed to receive it. If you're interested in banking cord blood, discuss it at a prenatal appointment. You only have one chance to collect and save baby's umbilical cord blood. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.